In order to reduce the risk of complications in the daughter, which of the following is the most appropriate intervention to recommend? 45-year-old man, history of recurrent nosebleeds, come to clinic concerned about his 12-year-old daughter. She has recently started experiencing nosebleeds similar to his own, and she has small red spots on her lips and oral mucosa. The patient's I guess, is this the dad, the patient's medical history?
Yeah,
Is
patient's medical
or
history.
okay. Um, Anemia, GI bleeding. You notice several telangiectasias on the man's face and hands. In order to reduce the complications in the daughter, which of the following um, is appropriate to recommend? So, okay, nosebleeds, anemia, GI bleeds, telangiectasias. Um, this kind of sounds like one of the hereditary, um, is it Puch? Maybe not. One of the hereditary, uh,
Okay.
increased, like, yeah. Um, okay, so he wants to reduce the risk of complications in the daughters. They usually have like bleeding. Sometimes they can have like polyps. Um, this might not be correct exactly, but we need to think if she's like already predisposed to bleeding, um, what do we want to do to avoid complications? So prophylactic antibiotics, that would be more, I think, like sickle cell. Um, Avoidance of NSAIDs, that might be an option.
Okay.
Frequent monitoring of blood pressure. Um, I would just leave it for now. Um, Oral iron supplementation. Patients will have complications, history of GI bleeding. And then surgical intervention, definitely not surgical intervention. So I think probably the middle three. I'd probably
Okay.
say I have it down between iron supplementation or avoidance of NSAIDs. NSAIDs could make it okay. Patient's medical history is significant for anemia and has a history of GI bleeds. So do we want to start iron in her? Or do we want her to? I think I'm going to say avoidance of NSAIDs because she's already predisposed to bleeding. We don't want to make it worse.
Okay. Yeah, exactly right. So she probably has hereditary um telangiectasias, right?
Okay.
Hereditary hemorrhagic telangiectasias or also Weber-Windu syndrome, right? So HHT, right? So they have a lot of telangiectasias, these superficial vessels that like to bleed. It's usually an autosomal dominant, right? Trait, so which makes sense. But yeah, so avoidance of NSAIDs, right? Because when you bleed, you don't you excuse me. So when you bleed, right, you're already having an increased risk of bleeding. So you don't want to add to that by having issues with clotting too, right? So that's not going to great, right? So um, you have an increased risk of bleeding, and then on top of that, now you can't clot or and stop. So that's not great. So definitely avoidance of NSAIDs because you're gonna have a lot of bleeding. Prophylactic antibiotic doesn't really help with the prevention of bleeding or anything like that. Monitoring of blood pressure not really required for HHT patients, and also this kid's young, so of course, blood pressure plays a role. If you have high blood pressure, then of course you're going to have an increased risk of bleeding or increase, how do I say this? When you bleed, you're not going to be able to stop as well if you have high blood pressure. So you definitely want to control that. Oral iron supplementation, right? That kind of helps with anemia per se, but it's not going to, if you bleed and you can clot normally, then, it's not going to be a big issue there. Surgical intervention, right? This can be considered later on in life, but you just don't do it up front. You get what I'm trying to
Okay.
say? So you don't just go, oh, let's just because it's a hereditary thing. You have a lot of superficial vessels, but yeah, there are things, especially in ENT, that you can do. You can laser the telangiectasias, right, to kind of specifically burn those superficial vessels. You can do a lot of things to it, but definitely it's not going to be the first line. So things to avoid is NSAIDs, high blood pressure, etc. But NSAIDs here is going to be your best answer.
Okay. And I looked it up. The Peutz Jeghers, that also has well, it has hyperpigmented on the mucosal surfaces, but it has the GI polyps. That's what I was
Yep.
mixing up.
Yep, Peach Jaeger, but remember, Peach Jaeger, they don't describe it as red spots. It's usually hyperpigmented mucosa, right?
Yeah.
A lot of times is how they describe it. And also, you're not going to have, per se, a lot of nosebleeds with that. So, yeah, so just slight differences for sure.